Well, welcome everyone. It's Wednesday, August 31st. Welcome to the Society of Thoracic Surgeons Intermacs User Group webinar. Today's focus is going to be on the new users for the Intermacs database. So we'll go ahead and get started, and I appreciate everyone being here today. I'm just going to go through a few housekeeping rules. And again, welcome to the new Intermacs data managers and data coordinators. Want to first thank the team from the Intermacs Data Warehouse, Patricia Potter, who's the Quality and Nursing Informatics. John Pennington's our Senior Data Manager, and he sends out all the data sets and helps with the database. Maceo Cleget is our Report Specialist, and Jeannie Ann Love is our the Patient Manager and Management Director. So before we get to the to review AQO, some housekeeping rules. If you have questions, please enter your questions in the questions section, not the chat box. And we have a few updates. We have an AQO meeting, which I'm going to discuss in a minute, on October 26th for the Intermacs users, the Intermacs database. But for that, we have some updates coming out in PDMacs. We added some new variables, and we also are currently working on a PDMacs dashboard that will be available in November. We'll launch it. We'll actually review it and launch it at the AQO meeting in Providence, Rhode Island, October 26th. So I'll go ahead and get started with AQO. So as I keep saying, the Intermacs Day is October 26th. In Providence, Rhode Island. You can register up until the day of. The early bird registration's already passed. If you haven't sent in, here's just a little review of the cost of it. And these slides will be posted on the STS website later on this week. So these are actually the slides. Let me go back. For AQO, the date's October 26th for the Intermacs database. This is just a listing of the price. And like I'd mentioned before, when you couldn't see the slides, there'll be actually this slide deck will be posted on the STS website by the end of the week. This is just some of the options you get, whether you're going in person or virtual. And then this is just a few of our programming topics that we will discuss. I believe the deadline's already passed to enter any scenario questions, but we had offered that, and I'm not for sure we received any, but hopefully we did. And again, you can go ahead and register for AQO up until the day of. So appreciate it and hope everyone, those that are able, can come. So I'll go ahead and review the COVID-19 update because it's still in effect. Televisits are encouraged. Your QOL surveys may be done over the phone or by mail, and I know that's challenging for the patients to have to complete them, especially by mail, and send them back. But you can just try your best to get those quality of life surveys done pre-implant and post-implant. And then we're still allowing late follow-up visits due to COVID in certain areas. So if your follow-up visits are done outside of the visit window, please enter the last date of the follow-up date visit into the database. And sites have 30 days after the follow-up window due date to enter the data for the COVID-19 exception. So today's webinar is just going to be open discussion. And again, as I said earlier, please use the Q&A function. We'll try to answer as many questions as possible. We encourage your feedback and we want to hear from you. And here's some contact information for myself and Patricia. And then any database operational questions, you can also use the Intermacs FAQ mailbox. We have plenty of resources on data entry. We've got the STS National Database webpage, the Intermacs and PDMacs webpage, which you'll find all things Intermacs there. There's actually a link embedded in the STS National Database webpage that will take you to the Intermacs and PDMacs webpage. But since this is going to be targeting new users, I'll go ahead and review that. So when you get to the Intermacs webpage, you'll click on appendices and you'll see where the user guide is. There's actually a YouTube of a training video. The adverse event definitions are listed there. Most importantly, our user guide, the Intermacs and PDMacs user guides are listed there. We also have a FAQ user guide that Patricia works on every month. And we update it with questions within certain sections of the user guide. There's also an option to print out all the data collection forms. And you can also, we don't have the quality of life surveys posted, but there's a link to Jeannie and Love's email at UAB. And if you click that link, she'll be more than happy to send you the hard copies of the quality of life surveys. You'll also find the updated participant contact form. That form specifically for if you want to add new members to either enter data at your website or for them to be read-only, then you would complete that form. And you'd also complete it to remove staff from your form, from your site. We have a data quality report validation form. We went over that at the last webinar, and that's specifically for the data quality reports. If you have updated data that was asked to be validated in that data quality report. Our next user group webinar is September 28th at 1 p.m. Central Time, and we have our next Intermacs reporting webinar October 20th at 2 p.m. Central Time. We'll not have a user group in October due to the AQO meeting, but we'll resume possibly in November. And just want to thank everyone for joining. I'm going to leave the resource page up, and we can take questions at this time. And again, please use the Q&A function and not the chat box. Thank you.
Thanks, Catherine. It's Patricia. It looks like we have a couple questions sent in, so I'll go ahead and start answering those. The first one from Sherry, regarding Rankin scores as patients age and they begin to decline, how do we show that in regards to the Rankin score? Say a patient's score was a 2, but now due to age and declining health, they are looking more like a 4. What should we chart? Sherry, if you could send me this one in an email, I'm going to have to check with Dr. Kirkland because I'm not quite sure how to answer this. If you send it to me in an email, my email is pkpotter@uabmc.edu. I will check with the Intermacs team and I will get back to you, and I'll also include this in our FAQs that I will be updating at the end of the quarter. So sorry I don't have an answer for you, but I will get back to you on that. Our next question. What is the correct dose to enter when diuretic is ordered PRN? So when the patient comes to follow up, if it's documented, if they took any of the PRN diuretic, if that dose is noted on there that yes, they did take some, and say they took it, just a few days, normally you would just enter an average of what they took over that follow-up window of what they took. But if the diuretic is PRN and they didn't take any, you could just answer no to that question on the medication form. Okay, next question. Hi, I'm looking for resources that data managers are using for reference on VAD, cardiac medications, procedures related to the VADs as refresher tools, such as books and/or online tools. I've been away from cardiac for some time, looking for quick reference tools when entering data into Intermacs. Thank you. Well, welcome to Intermacs. You're always welcome to reach out to me. I'm a resource for you. You can always email me if you have any questions as far as books and online tools. I can't think of anything that would be super helpful off the top of my head, but if anybody wants to put anything in here in the Q&A, we can share it and come up with some ideas together. But if you have any specific questions regarding data entry or anything, you're always welcome to reach out to me. And my email is here on this slide, and I'm Patricia. All right, Sherry, I'll definitely get back to you. Are non-VAD related hospitalizations or ER visits considered an adverse event? So it's not an adverse event, but it is entered. We have a rehospitalization form. So you'll just enter that one if the reason is non-VAD related and it's not infection related, bleeding related, neuro related, any of our AEs, adverse events, then you would not fill out those forms, but you will fill out the rehospitalization form for any hospital or ER stay that's 24 hours or greater, even if it is non-VAD related, motor vehicle accident, hip surgery, anything like that is entered as long as the stay was 24 hours or more. And even if the stay is coded as observation or outpatient, if it's 24 hours, if they were in the ER for 24 hours or more, it is entered into Intermacs. Okay, our next question. We have challenges in getting patients to fill out the quality of life surveys simply because patients do not want to do it. Has any institutions moved away from having the forms filled out? If so, are there any implications from doing this? No, there's not implications or penalty or anything for not doing it. I know it's challenging, so I don't know the best answer to this, if it can, if they can be mailed to the patient, or if you're able to get in touch with the patient over the phone, or trying to use alternative ways. I know it is time consuming when they come for their clinic appointments. So no, there's no implications, but we do highly encourage that the forms are filled out. I was instructed before that PRN diuretics are not documented. Was this recently changed? No, there was no change to this. It's just that, it's hard to quantify what the dose is when it is PRN, but if it is documented at the follow-up clinic visit that they did take it and how much they took, yes, do please enter it.
To add to Patricia's response about the PRN dosage of Lasix, so that's something that Patricia and I are going to work on with the Intermacs task force, is coming up with wording and how to collect, make it more clear how to enter the PRN doses of Lasix. So that should be coming this fall.
Yes, thank you, Catherine.
It won't be so black and white. I mean, so gray. It'll be a little more, provide more instructions.
Okay, next question. Hello, do planned admissions such as for transplants count towards readmission rates? John, do you know? I'm not sure how readmission rates are calculated.
I'm not for sure either, but I think the Maceo may know, but the rehospitalization rate, if they are rehospitalized, I'm not for sure if it's counted as the readmission rates. Would have to get back to her.
I did, yes, I will get back to you. If you send me this question in an email, I'll follow up with the team that calculates those rates, and I will get back to you. But I did also want to mention, while we're talking about readmissions for transplants, I've been working on sending out some data queries, and one of the things I did want to mention was when you do fill out the rehospitalization form for a transplant, the discharge date is the date that either the VAD was turned off, explanted, decommissioned, or the date of the transplant. I've noticed some of the forms that, the admission date for the transplant will come in, and then the discharge date is marked as unknown. And I just wanted to mention that the discharge date should be your explant or transplant date, which are typically the same day. So I just wanted to add that in there. We have implanted our 10th patient. When will be able to access reports from the registry? So Lisa, now that you have some patients in the registry, you can always use the live data downloads. You can go in and you can look at the data that has been entered live. The next reports, Catherine, will those be in November?
Yes.
The next round of reports will come out September 30th, and that'll be Q2.
Q2, okay. I believe you're working on a training manual for each data variable. When can we expect it? So we do have a user's guide, Shirley, and that goes through all the forms, including the screening log, the demographics, pre-implant, implant, all the follow-up forms, and all the AE and rehospitalization forms. And that is available on the website. If you go to appendices, they're all listed on there. Or Shirley, you're always welcome to email me and I can send you a link to those resources as well. For pulmonary hypertension as a comorbidity, is there a time frame for using values from a right heart cath? So on the pre-implant for the comorbidities, you would use any time up until the device. On the follow-up, you can use any, right heart cath or any, you can use any right heart cath leading up to that follow-up visit, from the previous follow-up to current follow-up. Okay, next question. Do institutions have access to the broken out HeartMate 2 versus HeartMate 3?
This is John. I mean, to try to redeem myself from my incorrect info on the report. The device brand is available in those live data downloads you referenced. Any data that a hospital enters is available back in the live data download.
Okay, thank you, John. Clifford, I'm not sure what the question is. Do institutions have access to broken out HeartMate 2 versus HeartMate 3?
Yeah, I'm wondering, I think John's right. She could break that down herself.
It would be, it's also in the quarterly data sets. I mean, we've obviously, if you're trying to do something like benchmarking, comparing yourself to all of Intermacs, I don't know if that's available via the dashboard.
Abbott recently presented some of their outcomes.
Yeah, I think they may be able to do that with the dashboard, but I'm not 100%. That's probably a question I'd have to ask Ryan, but.
But 100% Clifford, you can get to that data through live data download or your quarterly data sets. Sorry.
Correct, yeah.
More questions on the pre-implant form. When asking about classes of medications that the patient has taken, most of the options of current, known previous use within the last year, and no, but ARNI is just a yes, no, unknown. How are we to interpret this? Only select yes if the patient is currently taking it. Sarah, I recently answered this question. If the patient is currently taking it, yes. If the patient has taken, I'd have to look at the medication form. Give me 1 second, I'll answer for you. I believe it's, you can see all the time up until 60 days, from 60 days until time of implant. Yeah, the pre-implant form should be collected at the time of implant or closest to implant date within 60 days pre-implant, but not in the OR. So yes, if the patient is currently taking it, you would answer yes. I hope that answered your question. Does that sound right, Catherine?
Yes, that's correct. The patient is they're currently taking it. With the ARNIs, we didn't go the route of how we did some of the previous medications. So they just want to know, are they currently on it? The task force didn't really care if they were on it previously, just current use. Current use is why you would just check yes.
Perfect. Thank you so much for clarification, Catherine. All right, are a minimum number of patients required to receive a quarterly report? Our program is new, just want to have realistic expectations. Thank you. No, I don't think there's not a minimum number to receive a quarterly report. If you have patients entered, you'll receive at your center, you'll receive a report. If a patient had Hodgkin's lymphoma prior to VAD, would the answer to history of cancer be yes, or is this question referring to cancer since the last follow-up? Yes. If they have a history of Hodgkin's lymphoma, then the answer would be yes. Okay, another one related to Sarah Lear's question. Are you saying to say yes if they are taking medications within 60 days pre-implant period or at any point in the past? So on the pre-implant form, as you guys know, it's broken down to currently using, known previous use in the past year. So currently using is at the time of VAD placement. Known previous use is just within the past year at some point they did take it, and no, they are not currently taking and they have not taken it in the past. And then the last option is unknown. We're not sure if the patient ever took this medication. So for this question that's not broken down by currently using, known previous use, no, and unknown, it's just, have they taken it in the past 60 days pre-implant? Are they currently taking it or have they taken it before? We haven't, it's not as broken down as some of the other medications that we're interested in collecting. How recently have they taken it? Are there questions in the chat box or no? Okay. Anybody else would like to send in some questions? I'm happy to answer them. Okay, we got another one. Regarding a training manual, it would be helpful to have each variable on the data collection form with a definition like we have for STS adult cardiac. For example, for the variable, was there hemolysis event since last follow-up? The resources on the STS website do not address variables. You're right. So our user's guide is a little bit different than the STS training manual. We do have for a lot of our questions and data fields on the forms, we do have helper text, which can be helpful. But if there's a specific question you have regarding any of these, feel free to send them to me. I can put them on our FAQ. We can, if things are not clear, we can always look at clarifying that for you or clarifying the question. So yes, it is a little bit different, but we do have the user's guide and the FAQ document. So
Thanks, Patricia. Just to add to that, we have added a lot of the data entry helper, like you said, helper text to all the questions.
at the top of the forms, there's helper text on all of them. And then some of the specific questions do have extra text because we know that, it's hard to sometimes figure out what we're trying to ask. So, but if there's anything that still seems gray to you, feel free to ask and we can add that into our FAQs. Will you add FAQ to future iterations of the user guide so we can learn from what others ask? So yes, Ashley. So if you go to the Intermacs website and go to appendices, it's under, I think, appendices, and go to Intermacs appendices. It is under Appendix P at the very bottom. It says Intermacs FAQ Users Guide, and we update that quarterly. So I will update it again at the end of October with questions that have come in from this quarter. And I do essentially that just when I get frequently asked questions or a question that I think is a really good question that maybe seemed a little bit gray to me, I do include it on there. But you can find that at Appendix P. In the live data download pre-implant file, there is only one field for mean RA pressure and CVP, as it is now collected in version 6.0. Where can I find the individual fields when it is collected as two fields, mean RA pressure and CVP?
During that revision, those fields were mapped. So since there's only one live field, that's what we make available.
Thank you, John. So now it's just one field, so it's now just available as one. Is that correct, John?
Whenever we do mapping or whenever we do like database revisions where we update what's collected, if there was a question that was asked in the past, like say a comorbidity was asked that we no longer ask, I'll try to maintain that for users in the quarterly data sets, since that information basically, it didn't go anywhere. If we don't ask it anymore, it's just kind of in a black hole if I don't provide it. But if we do mapping where we combine two fields or something like that, I'll only include the current live field since that data was carried over.
Yeah, just to add to that, the live data downloads, just as John and Patricia have said, when we have a version upgrade, the live data downloads is also upgraded to match the new version.
Okay, our next question. Would love to have a training manual to assure everyone collects the data the same or accurately. Yes, we definitely want to all be on the same page. And that's why we have these webinars, the user's guide, FAQ document. And we try, on the webinars, we go over anything, any revisions we've done to the forms and answer any questions. But yes, and we also do the monthly data integrity checks that we go in just to make sure that the data is clean and that there is no question. But yes, Bonnie, if you ever have any questions, feel free to reach out to me. Did they overwrite because I have historic patients that the abstractors feel they collected one or the other, but the field is now blank?
Patricia, I second guessed myself on that answer just a minute ago. What I said about mapping stuff is true, but we did not map RA pressure. So they made me, thank you for asking this because you made me second guess myself. So the RA pressure would be, because that was something that wasn't mapped. No, of course, we're not going to overwrite data if there was data there and there was nothing to replace it. If you look in your most recent quarterly data set uploads, you can find it on the website, similar location where you would find your reports. Any of those historic RA pressure fields would be in the SAS data sets or the flat files, either or that I upload. So no, so if there were data that were entered there in the past, it would be in those fields and those data uploads. But because it's not live, it's not going to show in the live data download.
Thank you, John. Appreciate that. I hope that clarified your question, Jeanette. Next question. Does survival data include patients that were transferred to our facility, or does it stick with the implanting facility? It sticks with the implanting facility. So when a patient is implanted at a site, all of that data stays with that implanting facility, including survival data. I think so far that's everything.
Yeah, if y'all have any questions, please don't be shy and please ask them, because this is a good time to ask them. We have a good group of personnel from the Intermacs Data Collecting Center. So
Oh, we got one more. So how would I track our transferred patient survival if we no longer abstract for them? John and Catherine, you can correct me if I'm wrong, but I'm pretty sure it still should show up on all your reports, and you can still see the patient in Intermacs under their Intermacs ID. You just can, once they're transferred, you can no longer document on them. Okay, that looks like everything. My email address is on here. If I told you to follow back up with me, just send me your question and I will get you an answer and get back to you. Or if you think of something after the webinar, feel free to reach out to me.
yeah, thanks everyone for joining today. And if you have any questions, now's your chance. To have them answered live. If not, as I said earlier, this will be recorded and posted on via STS on YouTube. It'll be available on the STS website. The slides will be, you just have to, you can actually search Intermacs webinars and it'll pop up. So you can quickly go to these slides in the YouTube video. Looks like we had one more slide of question in, Patricia.
Oh yeah. How have the Joint Commission surveys been going at sites this year? Is there anything they are focusing on for data? Dan, I'm not able to answer that question. I'm wondering if maybe other users on, or other data managers on the call could chime in on that. They could probably speak to better what the Joint Commission is focusing on for VAD surveys.
Yeah, I've not heard, so I wouldn't be a good resource either.
And Catherine, is the agenda for AQO, is that posted yet? Because I did want to share that there's some really, I know we have a lot of new users, and I think that there'll be a lot of really good content for new users at AQO.
I believe it is posted, Emily, if I'm speaking incorrectly,
yep.
Please let me know.
Yeah, there's a preliminary agenda on the website right now, if you want to pull it up. And we'll post an updated one with speakers here shortly.
Thank you, appreciate that. We're going to have like case scenarios, and there will be time for questions and answers, and there'll be a lot of really good content specifically for new users. When answering the question about post-implant dialysis, does that include temporary dialysis or chronic dialysis? Renal dysfunction is one of our AEs. So if the patient is on post-implant dialysis, even if it is just temporary or CVVHD, then yes, that does meet the renal dysfunction AE and is counted. I can't add more detail, but the clinicians at my site were speaking about nutrition plan and documentation. Sorry, I can't add more. Thanks, Jeanette. I think she's speaking to what the Joint Commission was looking at for the VAD surveys, nutrition. Yep, the Joint Commission. Okay, Deborah. Also asking about how adverse events were reported in Intermacs. Deborah, are you referring to the Joint Commission was referring to adverse events? Yes. Oh, okay. Good to know. Thank you. Dan, last year we had a Joint Commission survey. They were looking for your VAD MD orders and how the VAD team carried it out. Thank you.
Well, thanks to everyone that helped Dan with his Joint Commission survey. I hope you pass with flying colors, Dan. But I want to thank everyone for joining today, especially the staff at the Intermacs data warehouse and Curso. And Patricia, thank you very much for answering the questions. Again, I sound like a broken record, but this will be posted on the STS website by the end of the week. And I appreciate everyone joining, especially those from STS, Carol Crone, Leanne Jones, and Emily Conrad, along with our Intermacs data warehouse colleagues. And thanks everyone very much. And I hope you'll have a really good week. Thanks.